Uterine fibroids and adenomyosis, causes, symptoms, treatments, and expert care at the Leg Pain Clinic. Introduction. Uterine fibroids and adenomyosis are two of the most common gynecologic conditions affecting women, particularly in their 30s and 40s. Both can cause heavy menstrual bleeding, pelvic pain, and reduced quality of life. Fortunately, minimally invasive options like uterine artery embolization, UAE, offer effective relief without the need for surgery. At the Leg Pain Clinic, Dr. Bilal Anwer, an interventional radiologist, offers expert, non-surgical care for women suffering from fibroids and adenomyosis using image-guided techniques that preserve the uterus and accelerate recovery. Understanding the conditions. Uterine fibroids. Fibroids are non-cancerous growths of the uterus made of muscle and fibrous tissue. They can vary in size and number and may grow within the uterine wall, on its surface, or inside the uterine cavity. Pathophysiology of fibroids. Fibroids are hormonally responsive tumors, primarily influenced by estrogen and progesterone. Their development is also associated with genetic factors, growth factors, and abnormal vascular response. Adenomyosis. Adenomyosis occurs when endometrial tissue lining of the uterus grows into the muscle wall of the uterus. This leads to a thickened, enlarged uterus that can cause intense cramping and heavy bleeding. Pathophysiology of adenomyosis. Unlike fibroids, adenomyosis is a diffuse process. Trapped endometrial cells within the myometrium continue to respond to menstrual hormones, causing inflammation, swelling, and pain with each cycle. Common symptoms. Although fibroids and adenomyosis are different conditions, they often present with similar symptoms, including heavy or prolonged menstrual bleeding, menorrhagia, severe cramping or pelvic pain, painful intercourse, bloating or pelvic pressure, frequent urination or constipation, fatigue from anemia. Treatment options. Treatment depends on the severity of symptoms, patient age, fertility goals, and personal preferences. At the Leg Pain Clinic, we focus on minimally invasive uterus-sparing options like uterine artery embolization, UAE. Conservative options, NSAIDs for pain control, hormonal therapies, iron supplements for anemia, surgical options, myomectomy, surgical removal of fibroids, hysterectomy, complete removal of the uterus, uterine artery embolization, UAE. UAE is a minimally invasive procedure performed by an interventional radiologist. Using imaging, a small catheter is inserted into the femoral or radial artery and guided to the uterine arteries. Tiny embolic particles are injected to block blood flow to fibroids or adenomyotic tissue. Benefits of UAE. The procedure requires no incision or general anesthesia. It is performed on an outpatient basis. The uterus is preserved. Recovery usually takes 5 to 7 days. It effectively treats fibroids and adenomyosis. It is covered by most insurance plans. Dr. Bilal Anwer, expert care at the Leg Pain Clinic. Dr. Bilal Anwer is a fellowship-trained interventional radiologist with extensive experience in image-guided procedures for women's health. His precision and compassionate approach have helped countless women avoid major surgery and reclaim their quality of life.